First, a new scheme that's the first of its kind in England is helping keep some patients in Hertfordshire out of hospital. It's all down to a hospice in Letchworth that's providing beds and rehabilitation to frail people without a terminal diagnosis. The number of people aged over 85 in the county is predicted to rise more than 70% by 2043. Our health correspondent Nikki Fox has this report.
Can you describe the last few years of your mum's life in 3 words?
Alone, lost, sad.
Carol Power's mother Anne struggled with urinary tract infections, falls, diabetes and IBS. With the age, there are things that can be harder to recover from. She didn't get help. This hospice wants change for those like her.
We're getting better for being in here. Thank you very much.
Connie Yearley had pneumonia and was treated in hospital. Now she's at Garden House in Letchworth to get up to full strength.
I'm very much looking forward to going home, but I'm also extremely grateful to know that I will feel better and stronger and more able when I do go home.
So how do they know who can come into their beds? Well, it's a partnership between the hospice and this hospital. And every weekday, nurses like Jenny Hadley go into the Lister to the A&E department and the wards to assess who's safe enough to be transferred.
Tucking our elbows into our rib cage and taking our hands out for 10.
Back at the hospice, they run weekly exercise classes, provide follow-up appointments and a community hub. Some people might not want to come to a group like this because they know it's a hospice, but it's very different from what you'd imagine.
Yeah, I must be honest, when they first said to me about coming up here, I thought, oh, I don't know, that ain't for me, No, it is important to keep yourself going because you don't want to end up in a home. I don't, or in hospital, come to that.
I know that there are thousands of patients with long-term conditions who have been in and out of hospital possibly 14, 15 times in the last year. That's why we're doing what we're doing.
The care system believes frailty is one of the major public health challenges of the 21st century. Hospices like this say they're not just there to help people have a good death, but a good life where they can. Nikki Fox, BBC Look East.